Hello. So today I wanted to address a question that I frequently get about some of our newer age flea preventions. There are a lot of Facebook groups and social media things and whatnot that talk about flea preventions killing pets or causing seizures in pets or causing issues in pets. So I kind of want to touch on that. So our newer age of flea preventions do typically come with a warning that says use with caution in seizure patients. Now we need to understand these medications don't cause seizures. So let's talk about what they actually do. These medications lower what's called the seizure threshold. So any animal, any creature that has a brain can have seizures, and they all have a seizure threshold. That's the stimulus level that they have to reach to have that seizure. And the stimulus is different with every animal. So that's what can make it a little bit of a challenge, just like it is with people. I have seen animals that have stress-induced seizures, heat-induced seizures. I've seen ones that if they have too much protein in their diet, they have seizures. If they have too many carbs, it's a challenge to figure out what's causing their seizures and what is their specific stimulus that causes it. But let's say you have a patient that has seizures, and this is their seizure threshold. This is the level their stimulus has to get to cause a seizure. This is their normal level, right? So they're living their daily life, they're doing their thing. Only occasionally do they get enough stimulus to top that seizure threshold and cause a seizure, okay? Now, some of these flea preventions, if this is their normal seizure threshold, this is where they normally live, it may lower that seizure threshold. So instead of being here, it suddenly becomes here. As you can tell, that would take a lot less stimulus for them to get to that threshold to cause a seizure. So there are some animals that get flea medications all the time, and that seizure threshold lowering doesn't increase their seizure number. There's some animals that it can actually bring them to their first seizure because they've never had enough stimulus to get them to that threshold before. So that's why we say use it with caution in seizure animals. We do still have some animals that have seizures that get these medications, but we try not to if we have other options like topicals or injectables or collars or whatnot. But it is recommended that if you have an animal that's on these preventions and has their first seizure, consider taking them off if there is an alternative medication to use. But the distinction has to be made. These medications don't cause seizures. They just lower that threshold.